Okay, so hi, good afternoon, everybody. My name's Harjit. I own a company called Longevity UK. I have a background in oncology and nutrition and movement, and we basically help people understand their health on a deeper level and use the tools of supplement, nutrition, movement, and using some advanced therapies like peptides to support people's health. So before I go on to peptides, I thought it would be helpful to just understand where peptides actually fit into a health journey. And that's quite important to understand because peptides themselves, whilst they are powerful tools, the way for them to work at their best is if you master some of the basics, which quite honestly is the boring stuff. So if we imagine health as a pyramid, and at the bottom of the pyramid you've got things like nutrition and movement. So this will be looking at the things that you're eating, how you're exercising, and these things you can do them as just general things like making sure you have enough protein and things like that. But you can get super specific. So we know that our nutritional demand is different based on our genetics, and we're all different. So there are advanced insights that you can get to understand exactly what type of nutrition is good for you. And by that I don't mean what type of diet, whether that be keto, whether that be low carb, but actually looking at how you are able to manage your macronutrients, what are the correct eating patterns for you, and it's similar with movement as well. So we know that the components of movement are strength-based workouts, there's cardio workouts, but understanding the exact split that is appropriate for you is super important. So at the bottom of the pyramid you've got your nutrition and you've got your movement. As we layer up, you've got a next layer that is supplements. So things like how you're exercising, what you're eating is super important. And to get those insights, you have access to a range of different types of testing. And with testing, you categorize them as two types. You've got some forms of testing that tells us what's going on in your body right now, so a snapshot of you at one point in time. And those are things like your blood work, anything stool related, urine related, saliva related. And then you have the other type of testing, which is usually genetic based. And this type of testing gives you the why behind the markers on the other types of testing. So as an example, you may do some testing where you're presented with high cholesterol, so a high LDL level. And the reason for that cholesterol being high can be a lot of different things. It could be either your liver is making too much cholesterol, either your good one is being converted into the bad cholesterol, or it could be that the production is actually not a problem, you're just having difficulty in moving it out of your arteries. And to understand those things is super important because that will drive you to the exact supplementation and types of nutrition that you will need to do. So that's quite important. They're supplements and they're not substitutes. And again, you can get some forms of testing that where we know that, let's say you have access to about 20 different supplements that can work on your cholesterol, usually what would happen is you would try one of those based on the data that we have and all the information, and we make an educated guess as to which of those supplements would be appropriate for you. And then what you would do is you would trial that supplement, you take it for a few months, you retest, you see if it's worked. If it's not worked, you move on to the second one of the 20 supplements that are available. You do have some forms of testing that can tell you exactly which type of supplement is going to be appropriate for that cholesterol level. So you can get quite specific with supplementation as well. And the key to supplementation is to keep your stacks super lean. Like taking more than 10 or so supplements is not as effective as most people would think. You only need a few of the right things to be able to hit multiple different points on that blood panel for you. And it's important to note that the supplements, only a very small portion of them is the active ingredient that you need to do the job that it needs to do. The rest of it has bulking agents, things to keep it stable on the shelf. So the more that you're taking, the more of the other stuff that you're putting inside as well. So then the next layer up, and this is the top of the pyramid type of stuff. This is where regenerative medicine comes into it, and peptides fall into that type of category. So in that top of the pyramid, you've got things like stem cells, you've got things like peptides. Now, peptide is a collective term for short chains of amino acids. And these peptides that we use, and there's lots of different types of them. You get some, the most common ones that we all know, like your GLP-1s that are for weight loss. But you also get some that are for muscle building, they can be for skin, they can be for gut health, they can be for inflammation and aging. And understanding the correct peptide for you, your entry point, is super important. And the way that peptides work is that they are cellular signaling. Health. So many of you might have known this is a quite popular one, BPC 157, so body protective compound. All of us have BPC in our guts, and one of its responsibilities is to repair the gut lining. So it will go and bind onto the cells, tell them to talk to each other, and start to repair that gut lining. BPC has other properties. It's very common amongst athletes because it's a great recovery peptide as well. But because these molecules, they're quite large molecules in relation to other things that we take. So the environment that you're putting them in is super important. So when you're taking a peptide, you want to make sure that the environment that you're putting it in allows it to thrive and find the place that it needs to go to, bind to that cell, and start to upregulate that pathway that you need to work on. And the way that they differ from things like medications is when you take a medication, you're giving your body something that either it should be making itself, or the medication is going to do a process in the body that your body should be doing. So blood pressure medications, cholesterol medications, all of them across the board. Now, the common expression of buy a man a fish and feed him for a day, teach a man a fish and feed him for life, you can use that with peptides and medicines. So as an example, if you're somebody that is struggling with low testosterone levels, and your first thing that you'll put on is testosterone replacement therapy. So that's appropriate for some people, but for many people, whilst they're taking that replacement therapy, their levels will normalize, but as soon as you take it away, the levels are likely to drop. And that's essentially, in simple terms, when you give your body something that it should be making itself or doing itself, it starts to get a bit lazy. It thinks that I don't really need to do this anymore because I'm getting it from an external source. So as soon as you pull it away, your levels aren't going to normalize, they're going to drop, or they're going to increase depending on what it's for. With a peptide, you're actually going in and teaching your body that mechanism and that pathway that it should have been doing and can do, but doing it better, more efficiently. So when you do pull that peptide away, that process is already upregulated. So you don't get those drastic drops in levels or increases in levels. And that's a really clear distinction to make with peptides, because if you want to get the most out, so it may be that you do some blood work and you've come to me for the muscle building peptide. But on your blood work, we can see that you've got quite a bit of inflammation and there's some other background noise that's going on that needs to be addressed first. So you would go in with a peptide that would essentially clean things up a little bit and then move on to the more advanced type of peptides.
And the order in which you do them matters as well. So a lot of people, and it's quite common to do multiple peptides at the same time. So as an example, a common stack that you would do with the GLP-1s for weight loss. So the GLP-1 will bind to your GLP receptors and it will reduce your appetite. And because it's reduced your appetite, you're eating less food, so you're going to lose weight. But that weight that you lose isn't biased on fat loss unless you are taking adequate amounts of protein, which if you don't have an appetite is going to be very, very difficult to do. So the weight that comes off on the scale as you see it coming down is not just coming from fat, it's coming from other things, it's coming from muscle as well. So common stacks alongside that is that you would pair it with a muscle building peptide. So you're now taking a peptide that will help you with your appetite, so you're reducing your calories, but then you're also taking a peptide that can help with muscle building, which is going to bias the weight that you lose from fat loss. And that's just one example. There's loads of different examples of stacking them together. And as I mentioned, there's loads of peptides. You can do some for inflammation, there's some for skin, there's some for gut, there's some for recovery. But understanding the order in which you do them, so you may want some of the skin peptides and things like that, but there may be some immediate things that you need to work on. And the reason that's important is quite often those people that have had failed experiences on peptides whereby they either haven't felt too good on them or they haven't worked as well as they should have or none of their markers have moved is usually because it was too soon to do that and there was something else that they needed to do before that. But as I said at the start, a peptide is a tool. So if you're going to take a muscle building peptide, you still need to do the nutrition and you still need to provide the stimulus to your muscles. So you still need to be doing the training. Where they are different with somebody that's doing a peptide, nutrition and movement and somebody just doing nutrition and movement, the results that you get are more. So with the muscle building peptide in particular, if you're training hard and if you're eating the right amount of protein, you find that in your workout, you're able to push a little bit more. And that means that you're carrying more of a load over a period of time. Also, your recovery is better. So whereby you might have done a really heavy leg session on a Monday and by Wednesday, you're not quite ready to train again, you're super sore. When you take the peptides, because they work on recovery, you're able to go into that training session and push just as hard. So that's why you get the better results from them. And one final point is that peptides are not designed like supplementation to be taken for long periods of time. Because of that mechanism of going in and teaching your body what it needs to do, you actually only need to use them for short periods of time, and we call that cycling. So it could be that you take one peptide for about 2 months, and then you're off it, and then you go to the next one. And the duration, the dosing, and whether it's appropriate for you is really based on an individual level. If you've got histories of cancer and things like that, most of the peptides are not going to be appropriate because it can increase your risk for reoccurrence. So although peptides are quite accessible now, it's super important that when you do source them, you do give your own medical history and go to a place where they're going to ask you these type of questions, and also some basic forms of testing, because we still need to understand that your kidneys and your liver can metabolize these things and get rid of them so they don't build up. So yeah, order matters, quality matters, and on a peptide journey, it's quite common to see what peptides can do and think, okay, I want to do the muscle building one, the skin one, the gut one, all in one go. But I can tell you from years of experience on this, the slower you do it in the correct order, the maximum benefits that you're going to get from it. Because with some of them, and this is very common with GLPs, your body can get used to them. So if you imagine you only have 10 receptors in your body that can bind to that GLP-1 peptide, every time you're taking it, one of those receptors is occupied. So you take your first dose, 1 out of the 10 is done. You take your second dose, the second 1 out of the 10 is done. And it doesn't work that quickly, but just to paint a picture for you. Eventually, all 10 of those are going to be occupied. And at that point, what you'll find is you'll need higher doses of that peptide. And at that point, you're not getting any value from that peptide. If anything, you're probably just likely to get nothing from it. So that's another reason you cycle them. We call it your receptors can get desensitized, meaning there's not enough free space for these things to bind on. So you usually want to do a washout period as well. So whenever you are doing peptides, even the duration in between your cycles, how long you're doing it, how frequently you're doing it for, is super important. So if I could give one piece of advice is get your peptides from somebody that's going to ask the right questions, especially when it comes to your medical history. Do the correct form of testing to actually understand what is the entry point for you. And at the start, you may just want to start with one peptide. Quite often, I don't do multiple peptides if nobody's ever done them for the first couple of times. And then as you get a little bit more experienced with it, you can start to layer more and more in. Take your rest points in between them. And yeah, just be guided on them. But generally speaking, they're such powerful tools. They are the future of medicine. They're already being used in settings like oncology and things like that. So yeah, so that's everything. I don't know if there's enough time for questions. Does anybody have any questions? Talal?
I have a question.
Yes.
Thank you for that. Is, aside from feeling like your body pre and post take,
Yeah.
are there ways to measure or quantify the effect or to see whether the peptides that you've been taking actually have the effect that you desire?
Yeah.
In the same way that you would take
A
a regular
supplement.
blood test for
Yeah. Yeah.
LDL and you can see what it was pre and post taking statins. Is there something that, are there markers that
Is it measurable?
Yeah, it's measurable.
Yeah, so it's also important to note with some of these peptides, like if you're taking an inflammatory peptide, you don't wake up one morning and think, wow, my inflammation is down today, that peptide's really working. And this is where testing is super, super important. So whenever we see clients, it's a non-negotiable that you do a blood panel. And then when you're doing the blood panel, you're looking for those markers that you need to optimize and which of the peptides are going to help you do that. Now with some of them, like MOTSI is a very common peptide that people use. It's the energy peptide, but it's the one that works on mitochondria. Now, the ability to measure the function of mitochondria right now isn't as accessible, and it's not really that great right now. You can't really measure what your mitochondrial function is. However, on a blood panel, over a period of time, you will start to see some markers that have cleaned up. And this is where it's really important that you're speaking to somebody that understands why you're taking that peptide as well. Like for them, I would always ask the question, if you're giving me this peptide, what are you measuring to understand what the success of this is? In full transparency, with most of them, you're looking at other metrics. So you're looking at your muscle mass, you're looking at fat percentage. With some of them, you're looking at things like inflammatory markers, homocysteine, you're looking even at micronutrients. So with the gut peptides, one of the things that I would be looking out for is are the micronutrients getting at a better level? And a better level is individual. So on a blood panel, you'll see a reference range. But that reference range isn't appropriate for all of us. For like my need for vitamin D is different to my mum's need for vitamin D because we're both different ages. So having somebody that can guide you on that as well. And then with some of the aging peptides like epithalon, so one of the things it does is it increases your telomere length. So you can do some biological age testing, telomere length testing, and then you wouldn't test it in a couple of months, you'd wait like 6 months or so. So depending on the peptide, yeah, there's always going to be something that you can look out for. And that's where expertise comes in as well, with working with someone that has that expertise to understand where are we looking to clean this thing up. So yes, does that answer your question?
It does.
Yeah.
I have another one.
Yeah, go for it.
We're often told that the source of where you get the peptides is really important.
Yeah.
How do we as consumers know
Yeah.
where we're getting the peptides from? Because you could speak to a very sensible doctor that sits here in Dubai who says, yes, take this peptide.
Yeah.
It's not that doctor that's putting the formula together.
Exactly.
He's
Yep.
sending that request to
A lab and
the
yeah.
labs that are here.
Yeah.
Right? I don't know where they're getting that stuff from. So when people say you need to make sure the quality of the
Yeah.
quality of the peptides, how do we know?
Yeah, so there's a couple of things. You should always make sure that that lab or that compounding pharmacy has a GMP certification, meaning that the way that they're producing their products has to be in line with a very strict SOP. Secondly, every single peptide that you can get has something called a certificate of analysis, and that looks at the quality and the purity of that peptide. And a trick here is a lab that gives you a certificate of analysis that is very general is probably not a good one to go for. A certificate of analysis is very batch dependent. So I could have 2 vials of BPC right now made at a different time in the same lab. Those 2 things have 2 separate certificates of analysis. And those things are really easy to read. At the top, you'll be given some metrics that show you what the percentage of that purity is. Anybody that can't provide you with that is probably not a good place to get that from. And generally speaking, those places that you have to buy these things from that ask for a prescription have that added layer of safeguarding around them. If you're going somewhere where you can just buy it online and whatever, then ask those questions. Ask if they have GMP, ask if you can see the certificate of analysis for the batch that you're going to buy. And that batch thing is super important because you could have had a batch of BPC that was really good quality and they give you that certificate, but then the next one that you're going to actually get is, yeah, and they have to be tested, every single batch, any medication, any supplement and things, they have a certificate of analysis. Yeah. Sorry, I didn't hear. Yeah. Yeah, so they're all of the stuff at the top of the pyramid, so stem cells and all of those type of things. That regenerative medicine layer is emerging. It's the field of medicine that is evolving the quickest. It has the newest forms of therapies. So a lot of the stuff in that doesn't have the standard FDA approval and things like that. But they do have, like some peptides have clinical trials. So everybody knows about GLP-1s. There's now GLP-3s like retatrutide that are currently in clinical trials. The data that we have is from professionals and medical professionals that have been using them. And because they're naturally occurring, the safety profile of them is quite high because your body already has it. But anything that's emerging doesn't really have the data like a packet of paracetamol or Panadol would. And they don't have the FDA approvals of them. There are some peptides that have FDA approvals for some things, like tesamorelin has it for some form of high body fat in a specific area, but not necessarily for the muscle building. So they are emerging, data is still emerging on them. From a governance point of view, there are, even at universities now, from a professional point of view, you can get certified in being an expert in peptides as well. But like with most of these things right at the top, like even with stem cells, exosomes, and all of these type of things, they are emerging. Hi, yeah. Yeah, so, yeah, they are available in various different forms. So you can get them, some of them as oral form. Most of them are in pen form. I actually think I have one with me. So most of them are in like a pen that looks like an insulin pen. So you put a needle on the top and you would inject this subcutaneously. You get nasal sprays, you get patches for them. So it just depends on what is the most appropriate route for you in terms of, a lot of people get freaked out when they think they have to inject. The needle is very small, you put them into any fatty part. Nasal sprays and patches, they're becoming very popular now. They're a form of, they're allowing people to access them that didn't want to take the injected form. My advice would be, like BPC, you can get it in oral form. Because of the nature of the molecules, when you take anything orally, there's a lot of places that tablet has to go to before it is actually absorbed. So it's going through the stomach, it's going through your gut, then it'll have to go to the liver and whatnot. So oral forms are still okay, but things like subcutaneous forms where you're putting it into a fatty part, and anytime you put anything into a fatty part of the body, the absorption of it is a lot slower. And some of the peptides, you dose them daily, some of them you do every 2 days, some of them you do once a week. depending on what type of peptide you have. They're not genetically they're amino acids. So they are bioidentical because you already have that in your body. They're not genetic. Yeah, so yeah, well, I mean, I get a lot of young adults, kids to be honest, that want to do peptides, and it's not appropriate when you're younger. When you're younger, your body is at its prime, right? You have these peptides in abundance, so you leverage what you already have. As we get older, unfortunately, these peptides start to decline. So in males and females in particular, like things like the muscle building peptides are so effective. As we get older, obviously we're losing muscle mass, at least 1% per year, if that. And as you get older, your ability to actually gain muscle gets harder. But muscle is such an important organ, right, for longevity and health. So as you get older, using these, again, as a tool, so you still have to train, you still have to eat well, do your testing and find out where everything's at. But efficacy as you get older, like the amount that we have, does reduce. Yeah. Hi. Yeah. 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 Yeah, so first and foremost, when you're doing the gut, you would use an appropriate form of testing to see whether you actually need that. Secondly, there'll be supplements that you use alongside it, and the duration and the amount that you take is very dependent on what you're using it for. So if you do have a severely leaky gut, then you'll probably have to take it longer. For somebody that had some gut issues and they're just not feeling quite right, and their gut could just do with a bit of support, like something going in there and just calming things down for them. In terms of reusing them, so if you're using them for a reason of repairing something in your gut, then repeat testing would warrant whether you need it again. It's very unlikely that you would, because if you're doing the right nutrition alongside it, you're taking the supplementation with it, when you pull that peptide away, that process should be upregulated at that point. And you'll still probably be taking your supplements like your L-glutamines and all of that type of stuff that will carry on doing the work afterwards. And you use symptoms as a checker as well. Like if people say that they are feeling better, it's likely that the peptide's done its job, and I wouldn't use the peptides for longer than you actually need to, because at a certain point, you don't get any of the benefits from them for that reason. Your receptors become desensitized and you need that washout period. Yeah? Are we good? Okay, thank you so much, guys. Thank you.